Welcome to the Recovery Room. I'm Cancer Physical Therapy Specialist, Dr. Leslie Waltke, with update number 2 on the 2019-2020 novel coronavirus pandemic continuing to consume and disrupt our lives. In this episode, we are talking about two things. First, what the heck flattening the curve means, and number 2, why social distancing, though incredibly disruptive, is so incredibly important. This information, again, will come from the World Health Organization, the Centers for Disease Control and Prevention, and public health experts. You can find the links to these organizations' coronavirus information websites in the description section of this video. Also there, you will find the source for the statistics I will be sharing, as well as the link to the Recovery Room's first video on the coronavirus. Please note, information in this video is accurate as of March 20th, 2020. And please don't share the virus, but do share this video. The name of the virus currently grabbing the world's attention is the 2019 novel coronavirus. The name of the disease it causes is COVID-19. Now, you may have heard the phrase beginning to float around, flatten the curve. So what does that mean, and why is it a big deal? So people are going to get sick. So people overbought toilet paper. And we ran out of toilet paper. And people are going to get sick. And we don't want to run out of... Well, here, just watch. So here is a great example of what overbuying, panic buying, and overriding the system can do. I mean, this is my local Target. All right. Now, just imagine that this is your community hospital. Flatten the curve. So we now know for a fact that we have a limited amount of toilet paper and paper products at one particular time. So if they are all used up at one time, they're all gone. We know for a fact that we have a limited amount of healthcare resources at one particular time. Things like personal protective equipment, gloves, masks, gowns for healthcare providers, medications, tests, beds, blood products, ventilators, and healthcare people. Our hospitals are already and routinely full of people that have all sorts of things like strokes, injuries, accidents, heart attacks, cancer, and even the seasonal flu. So when we suddenly throw another huge amount of contagious sick people into the system, it is a problem. If there are more sick people than healthcare resources, a huge amount of illness and death will most certainly result. Some of these deaths will be from the illness, but some of the deaths will result from the fact that we won't have the equipment and personnel to save everyone's life. Regardless of your age, race, religion, creed, national origin, or country, that should be unacceptable to every single human. And this is the problem, and this is the reason infectious disease and public health experts are telling us to stay home and practice social distancing. When we lessen the number of people that need medical care, and when we spread out the time that people require medical care, it is called flattening the curve. Here are the most recent numbers from the Center for Global Infectious Disease Analysis. If we were to do nothing to limit this virus, there will be 30 times more people that need ventilators than actual ventilators, resulting in 4 million deaths just in the US and 90 million deaths globally in just the next 3 months. If we take minor steps now, like isolating symptomatic people, there will be 8 people that need a ventilator for every 1 ventilator available. And 2 million people would die in the US. If, however, we go all in with suppression tactics like we are being asked to, including social distancing, closing public events, closing public places, and staying home, there will be enough ventilators for everyone that needs one, and the death rate drops to a few thousand. Yes, this is awful to our lives, our jobs, our families, and our economies. But if we don't do it, it will be horrifying to our lives, jobs, families, and economies. While social distancing, stay in good verbal and written contact with your loved ones. Get outside, walk, bicycle, find open spaces to play. Keep surfaces clean. Keep your hands clean and away from your eyes, nose, and mouth. Stay 6 feet away from others. And let's just be nice. The more people that follow the rules, the sooner we get through this. Sheltering in place, staying home, limiting physical contact with others not only protects you from getting this novel coronavirus, but it flattens the curve and protects everyone. This will end, but not before it stresses the very medical resources that keep us all safe. This will end, and when it does, it will reveal our character. What every individual does matters. I'm Cancer PT Dr. Leslie Waltke, signing out from the recovery room. Stay safe out there, be a hero, and flatten the curve.